All right, good morning. This morning we have Nelly and J'nae, who are part of our critical services at Waypoint, on the video with us, and they're going to share a little bit about how COVID-19 has affected their programs and their clients and what as community members we can do to support them. So I just want you guys to maybe do a brief introduction on what you do at Waypoint, and then we'll get started.
Sure, I'm Nelly. I'm the director of the Domestic Violence Victim Services Program. So I oversee all the services for victims experiencing domestic violence.
And I'm J'nae, and I'm the director of our housing services. So I oversee all of our services offered to households experiencing a housing crisis.
Great. And I'm Autumn. I'm the development officer at Waypoint. So the first question we have for you is, how has COVID-19 impacted your clients within your program?
So, speaking for domestic violence, I think victims are even more isolated. COVID really played into the tactics that abusive partners use already, so isolation. So there, is a lot of experiences that we hear about on the crisis line about people not being able to leave. So people not being able to go to work every day and get the support from coworkers has really been a big impact.
Thanks, Nelly.
Yeah.
And I'm sure too, just with domestic violence, maybe their safe place was their work or a gym or things like that, and not being able to utilize those could be really difficult.
Right.
And I would say those experiencing homelessness or who are low income and living in poverty, they're more likely to be exposed to the virus just because they typically are working jobs that they do not have the ability to work from home. So they are living paycheck to paycheck. They don't have the ability to have any missed income. So they're more likely to be out and about in the community and exposed. And for those experiencing literal homelessness, just simply their living environment, living in an emergency shelter with 30 to 40 other households or individuals all in a communal living space increases anybody's risk of contracting any type of virus.
Right. What are the biggest barriers your clients are facing?
Sure. I think, I'm hearing from a lot of my advocates that clients are really worried about their housing. So being able to pay rent, many of the clients lost their jobs or were laid off, and so there's a big concern there. Other barriers really were kind of fear that if they decided to leave the relationship, there weren't going to be very many opportunities like employment and housing and transportation. So things kind of stood still, and survivors were really just surviving and continue to be surviving the abuse they're experiencing.
One of the questions somebody had asked me about the domestic violence program is, now that people are quarantined together during this time, if children were probably witnessing more abuse. What are your thoughts on that?
Absolutely. I think that children most likely not being able to go to school or to friends' houses, they don't have their safe haven. And a lot of the teachers were that safe haven. So we were really concerned about the kids experiencing it, secondary victimization. So that's accurate.
Oh, J'nae, you're muted.
Sorry. Just to kind of mirror what Nelly had said about individuals fearing that they're not going to be able to obtain or maintain their housing through all of this. That's a huge barrier that we're seeing with our clients. A lot of them are not able to obtain income right now. They may have lost their jobs, or they were in the process of housing search, and transportation system shut down. With the library being closed, that's a huge barrier for our clients. Typically, that's where individuals access free Wi-Fi or the internet to be able to check their emails or use their Wi-Fi based phones to even schedule an interview. And so without that, it makes it really hard for them to move forward in their goals to obtain a stable housing environment.
One of the questions people were asking me and J'nae about homelessness and housing needs were clients who we're doubled up, during this time. What does that mean now? Like once, things are starting to get lifted, what does that mean for those families?
Yeah, it could potentially mean eviction for those households that were allowing friends and family to double up during this time. The eviction moratorium was lifted 2 days ago. So Wednesday it was lifted, and evictions could now be filed. So we are just working with landlords as much as possible to come up with a plan for these households, saying, we will work with them, we will help them move on to another housing unit as much as possible. Are they willing to work with us and come up with a plan?
Perfect. So how have the services changed during COVID-19, and what are we still offering the community?
Yeah, so in the domestic violence program, our services turned into more mobile advocacy. We were providing mobile advocacy anyways, but the advocates were working remotely, providing peer counseling via phone. We started support groups via Zoom. A lot of the safety planning can be done over the phone as well. There were instances where we had to just respond to things to bring basic needs to victims. So I think services are absolutely still available. I think advocates are doing their very best, and survivors are still connecting with us. Our numbers have not decreased significantly because of these barriers, but I know advocates are really eager to get back out and see their clients face to face, just to see that they're okay.
It's good to know that, we just had to change up our service delivery, that we still could do services and provide services in the community through this COVID-19. So
yeah, I think services are not going to look that, we're going to have a lot of precautions, and we've talked about that. So when I say advocates are really eager, they're also kind of hesitant. They don't want to get their family sick. They don't want to get our community sick. So that's a concern too.
Yeah. What about you, J'nae?
Sure, yeah. All of our services are still running. We've had to make some adjustments. So most of our services are virtual, kind of like Nelly said with the domestic violence. So case management services are done via email or over the phone. Apartment viewings, we are doing those separate from our clients. So we'll go out and view the apartment and then schedule a time for the client to go, or we'll take pictures or Zoom the client so they can see the unit themselves. We are, our walk-in services are limited, but we are still offering all housing services in coordination for individuals seeking services.
Perfect. And the emergency shelter has been open 24/7 as usual, correct?
Correct. Yep. Our emergency shelter is open 24/7, and clients do have a safe place to self-isolate if needed.
Perfect. So this is kind of one of the last questions. Biggest need you're seeing, like what is the biggest need for your clients or within your program?
So right now, I think there's just a really big fear of housing instability. So the need is more assistance to create and maintain stability post-COVID or during COVID. And I think that's probably pretty similar for J'nae too. Our services do intersect a whole lot. And, we've talked with other agencies who provide domestic violence services, and we all kind of predict that there's going to be an uptick, and there might be a lot of people reaching out for support once some of the restrictions are lifted. So we're kind of bracing ourselves. So financially, I think there's going to be a lot of client need related to housing.
Yeah, I absolutely agree with Nelly. Just that prevention method of how can we quickly get people through the system or prevent them from entering the system altogether, because we are predicting a fallout from all of this. And then also just for our emergency shelter, increasing our volunteers. We've had some amazing volunteers to come help us during this time, disinfect the shelter during certain periods throughout the day, and that's really helped keep staff and clients safe and healthy. So just increasing that as well, and continuing those services and increase disinfecting and cleaning.
So one last question, how can the community help right now? What could the community do to support your program right now?
I think it's really important throughout this time that word of mouth, that we are still available. Just because Waypoint's main building was closed did not mean that services ended. So referring and offering non-judgmental support to friends and family members, not telling them what they need to, they should, they have to, but really providing a listening ear, compassionate support, and getting them connected to services. And also, because we're kind of expecting that uptick of client assistance need, donations are really important.
Right. Ditto to what Nelly said. And with donations, you know, right now we are asking for monetary or gift cards at this point in time. We do still have some restrictions in the building that we're trying to decrease the risk or reduce the risk of exposure within the shelter. So we're not accepting physical donations quite yet, but we are coming up with a plan that we can start doing that very soon. We do have a lot of amazing community members that are reaching out and wanting to donate. So we want to be able to let them do that.
Perfect. And one way that people can donate is online at our website, which is www.waypointservices.org. And all that funding will support these programs that we're still offering in the community, and there's a big need. So appreciate the community and your support, because we couldn't do what we do without that. So thanks, Nelly and J'nae, for your time this morning. It's always great to hear what's going on within the walls of Waypoint and what we're doing to change up our service delivery during this time.